All right, we're ready to go, folks. If you want to take your seats, and we'll start the next panel discussion and presentations. So, given the conversation that we've had this morning and the information that we've been going over, I think it's clear to all of us that what happens when you get in these kinds of environments and start talking about this is you create a lot of energy, number one. But number two, we start to ask the questions around implementation. You know, what does this really look like in the trenches? How does it affect clinicians? How does it affect patients? Are people happy? Are they not happy? What does it really look like? We know this isn't easy. We know there are challenges. And what we have for you this afternoon is a group of people who have been doing this not for a few months, but for several years. So their experience is a real testament to what we all need to learn in order to implement the kinds of protocols that we know will support patients and families. And we're asking the question, does this work to change an environment that respects the goals and concerns of every patient? And before we start this, I just wanted to read from you something that was written in the Health Affairs Journal that everyone has referenced this morning by Jessie Grumman. And I know a lot of you know Jessie. And she writes a narrative piece about her fourth cancer diagnosis. And as she's summarizing, she makes these statements that I think are pretty compelling. And she uses a phrase that I really want us to be thinking about. No clinician, insurer, or regulator could have devoted as much time and attention as I did to determining how I wanted to be treated or how I want to live. In retrospect, I am awed by the gravity of the decisions I made about my health care and by the limited evidence on which those decisions were based. At the same time, it took full-scale, sustained efforts by me and my family to develop and carry out my treatment plans to get the most out of my care. I am concerned about those who cannot summon such energy. They will suffer unnecessarily. I think we've had a lot of people make the points this morning that we do have unnecessary suffering. And if we don't underscore the point that we are doing harm and not good, and that this is about colossal cultural change, but we also need to do the kinds of systems and infrastructure work that we know will sustain this from here on out. We owe this to every patient and family member, and we owe it to ourselves. With that said, I am very pleased to introduce our completely West Coast panel. Thank you for making the trip here today. I'm not sure what that says about innovation, but we can figure that out, I guess. Okay, so we are going to lead off today with a presentation by Grace Lyn. She is an assistant professor of medicine at the Philip R. Lee Institute for Health Policy Studies at the University of California, San Francisco. Her research agenda focuses on resource utilization, appropriateness of care, shared decision-making, and measuring the quality of decision-making process, particularly in cardiology. Following Grace's presentation, we actually have three professionals from UCSF, including Jeff Belcora, who is an associate professor of surgery and health policy at the University of California, San Francisco. His professional mission is to help people grow in their capacity for leadership, teamwork, and decision-making. Margot Zarin-Pass is a first-year medical student at UCSF. She was previously a pre-med intern at the UCSF Breast Cancer Center. There she provided decision support services to patients and conducted patient engagement research. Lastly, from UCSF, we have Ekene Obi Okoye. She is a pre-med intern. Her current projects include studying the biology surrounding breast cancer recurrence, designing support programming for metastatic breast cancer patients, and participating in the patient decision support program at the Breast Care Center. And to round out the presentations today, we have David Otterburn from Group Health in Seattle. He's a general internist and a health services researcher who holds positions as an associate investigator at Group Health Research Institute and as an affiliate associate professor with the University of Washington School of Medicine in Seattle. His research covers a broad range, including comparative effectiveness of weight management interventions, pharmacoepidemiology, pharmacogenetics, bariatric surgery, and shared decision-making related to elective surgery. So welcome to all of you, and Grace, you're up.